We are so pleased that you could be with us to witness the passing of another group of medical students into the role of doctor. As I look out into the crowd, I see that there are many parents, family members, and friends who are as proud of their son or daughter, if not more so, than we are. So without further ado, let's go ahead and start the ceremony with the procession of the graduates. Our graduates this year will be led by Dr. Samir Fateh, President of Avalon University, along with a special guest, one of our previous graduates, Dr. Anthony Russo. Ladies and gentlemen, I present to you the 2016 graduating class of Avalon University School of Medicine. This is an exciting day for all of our graduates, family guests, and Avalon administration and faculty. My name is Michelle Richards. Most of you know me as the Director of Admissions here at Avalon, but for today, I'm going to be your MC. I've worked closely with many of these students during their time at Avalon University, some more than others. In addition, the whole Avalon administration has worked with these young men and women, and seeing the culmination of all their hard work is truly rewarding for all of us. To start off the event, it gives me great pleasure to introduce our first speaker in the line of university administrators, our university president, Dr. Samir Fateh, who has been exactly where these students stand today. He knows the challenges that every student face. Dr. Samir Fateh has served as a source of guidance and support to many of these students over the years. Whether it be advising about USMLE test strategies or counseling students with academic issues, Dr. Samir has always been available for students. He has been an advocate for these students and have always had their best interests at heart. Ladies and gentlemen, I'm proud to introduce Dr. Samir Fateh, President of Avalon University.
On behalf of Avalon University School of Medicine, I would like to welcome everyone to the 2016 graduation ceremony. This is by far one of the best days of the year for Avalon University, and it makes me proud to stand in front of all of our graduates this afternoon. I would like to thank Avalon University's Board of Governance, Board of Directors, Deans, and all members of the U.S. and Curaçao administration, and everyone that is associated with Avalon University. I would like to give a special thank you to the Minister of Education of Curaçao, Mrs. Irene Dick, for being with us today. It truly is an honor having you, Minister. Thank you very much. Graduates, the day has finally come. All of you should be very proud of yourselves for what you have accomplished. All of us at Avalon University can't be any happier for you, especially for being part of your journey through medical school and watching all of you grow into fine young professionals. The hard work does not end today, and as a physician, the hard work and process of becoming the best doctor that you can be will be for a lifetime. But for one day, let's not think about studying and work, and be proud of yourselves for what you have accomplished. Enjoy this moment because it's the great memories that will last a lifetime. When I think of this special day, and my thoughts are the thoughts of everyone that is involved with Avalon University, from the members of the U.S. administration, all the way to the professors, deans, and staff in Curaçao, it is the memories and happiness that we feel from watching all of you get to this position that you are today. For a lot of you, I still clearly remember conducting phone interviews for admission into Avalon University, to visiting the island and watching all of you work so hard and making the most of the opportunity, to seeing all of you so dedicated towards your education during your clinical rotations to now, graduating after years of hard work and sacrifice. For all of you graduates that we have been so familiar with over the years, it's just not the hard work that we have recognized, but it is the strong character that all of you have shown, and witness you mature into fine young adults has been truly admirable. The memories of the bond that we have made will be for a lifetime. As medical doctors, a new chapter in your lives will begin now, which means a new set of responsibilities and duties you must all serve. Please don't ever lose sight of your obligations of being a medical doctor, and I am confident that all of you will excel and be great in whatever you set your minds to. If you can endure the grind of medical school, you will be able to accept any challenge that comes your way. Today is not only a great accomplishment for you, graduates, it is a day in which your family members, relatives, friends, and all of us at Avalon University are showing great joy. You have demonstrated grace, dignity, and perseverance. You have put in blood, sweat, and tears required, and you now stand ready to receive your medical degree. Be proud of what you have accomplished and continue to be dedicated in becoming the best physician you can be, and an even better human being. To end my speech, I would like to say a quote from Helen Keller. Optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. Congratulations, Avalon University School of Medicine's graduating class of 2016. Thank you.
Thank you, Dr. Samir. Next, I would like to take a moment to introduce Dr. Abdul Ghani, our Dean of Clinical Medicine. Dr. Ghani is the perfect person to be in this position, as he brings with him a great deal of expertise in the field of medicine. He is a medical school graduate from the University of Karachi, Pakistan, and completed his residency in surgery in 1976 at our very own Northside Hospital in Youngstown, Ohio. He brings to Avalon all his knowledge and expertise from his time as clerkship director at NeoMed. Suffice it to say, his leadership and experience will be evident as Avalon strives to become one of the great schools in the Caribbean. I would like to invite Dr. Abdul Ghani to the podium to welcome you to this event.
Thank you, Michelle. Good morning, students, family, friends. Finally made it. Nobody said it was going to be easy. But in spite of a lot of ups and downs, I wonder, you often thought, did I make the right decision? Especially move to Curaçao, away from home, and all familiar family support. But you made it in spite of all that. You went through MD1, MD2, MD3. Tremendous hard work and sacrifice on part of all the students, family, and friends. But you finally made it. And then in MD4, from year one, you've been bombarded with all kinds of NBME, USMLE. What are all these words? Till you started getting nightmares about USMLEs. But you made it through all the stresses. And then finally, the last few weeks came, MD5. What is MD5? It sounds almost like an army tank charging at you. Well, that's the transition between basic science and clinical medicine. And this is what determines where you do your clinical rotations and finally the stress of achieving a residency. But you all made it through all these stresses and ups and downs. All because of your tremendous perseverance, hard work, and support from your family and friends. So graduates, it's an awesome achievement. Don't let anybody tell otherwise. So you deserve full credit and deserve all the congratulations to the class of 2016, to family and friends. So what's next? Well, this is just the beginning. You need to achieve a license to practice medicine. In some countries, you may require just a year of additional training. Those who want to get into the US system of medicine, you require a residency training. And that's, as you all know, I don't need to go through the data. You can get it on online. But it's a very competitive system. At this time, I would like to share some good news with you. Last year, we matched our students, 16 of them in residency position. But this year, we matched 30 students. Not only did we matched in 6 different specialties: family practice, internal medicine, emergency medicine, pediatrics, psychiatry, and OBGYN. And our residents will go to 16 different states, starting from New Jersey, New York, all the way to Nevada, Ohio, Michigan, down south, all the way to Atlanta and Florida. Again, congratulations, students. Several of the graduates are present here today, those who have received residency. Just a word to those who haven't matched or in the process of matching. I strongly recommend continue to work hard and you will get into residency, as you have seen your own colleagues achieving positions. Those who are in the process of applying, please continue to work hard and take your USMLE and USMLE 1 and 2. In fact, if you have time, there has been a recent change in the trend, and the program directors are requesting or looking at the applications that they, if possible, they would like you to see you passing the Part 3 exam also. I know this is taken during your residency, but that will definitely give you an edge over other applicants. So if you have time, and if you have motivation, and if you're ready, please go ahead and even prepare for Part 3. Those who have already matched, I have a message. Not only you deserve a residency position, but it will be a totally different lifestyle. Till now, you've been seeing your preceptors. From July 1st, when you start, you will be called and deserve to be called a doctor. And you'll be making decisions, whether you like it or not. You'll be actually seeing patients. You'll have to deal with family, with the relatives, with paramedical personnel, and you have to work with all of them. So best of luck to all of you. Some of you will finish your residency and you go into fellowships. Again, I'm proud to say we have, as of today, I know about 3 of our students have also gone into fellowships already. So this is what you have to look forward to. The field is wide open. I can't emphasize anymore. There is so much tremendous shortage of physicians. And unfortunately, the number of residency positions are limited, but this year they increased the number by 567 positions, new positions. And I'm pretty sure every year they're going to increase the number. So please continue to work hard. Those who have gone into fellowships and residencies, We would like to keep in touch with us, be a role model and mentor to our students who are going to follow you. If you do well in your residencies, it will help our students coming in future applying for residencies. Finally, I would like to thank the preceptors and the faculty for taking their time during the busy practice to teach our students. Just a special mention, talking about hard work, Kunzal Khan, I understand she's somehow related to Samir. I don't know in what capacity. He's our president. But like all of you, she's gone through lots of ups and downs, a lot of hard work. She did not get a pass, and she didn't get a time off. Today, she'll be collecting a diploma for 2. So those who haven't matched, I have a special message for them. Don't despair. This is not the end. Get some while you're waiting for the 2017 match. See if you can get some publications, some research. See if you can get the third part, and I'm sure you can make it. So all the best to rest of you. Thank you.
Thank you, Dr. Ghani. To deliver today's opening remarks, I would like to introduce Dr. Shaukat Fateh, Chancellor of Avalon University. For Dr. Fateh, this annual event represents the culmination of his vision. I personally have known Dr. Fateh for so many years, and I know the passion and determination that he puts forth to see that Avalon University is always growing in the right direction, and that whatever changes we make is always for the betterment of the students. We want to graduate practicing physicians, he says. Dr. Fateh has devoted insurmountable amounts of time to the university's educational system and curricula, and he is always looking at ways to continually improve and keep the university moving forward. For these reasons, I am so proud to be a part of it. It gives me great pleasure and honor to introduce Dr. Shaukat Fateh, Chancellor of Avalon University School of Medicine.
Thank you, Michelle. First of all, I would really like to thank the Honorable Minister of Education, Ms. Dick, to take time out and come here and grace this occasion. Obviously, I'm very proud of the graduates who are here and all the board members who are here. I'll be very short. And my message is always the same every year. We are very proud of what you have achieved. You should be very proud of what you have achieved. But don't sit on your laurels. You know, this is just the beginning. You will never ever cease to be a student in your life. And remember that. And I'm sure Dr. Ghani will vouch to that. He has been in practice for over 40 years. And every one of us who are here will tell you that you never cease to be a student. The day you feel that you know everything is the day you should retire. And even then you study. So just keep studying. And that is the way of life. I think it is one of the most honorable professions in the world. You directly affect a fellow human being. And I see very few professions that do that. So be proud of it. But at the same time, the MD degree comes with a lot of responsibilities. And one of them is that you treat your fellow human beings right. And please keep that in mind. Really, there is not much to add. Annually, I always take this occasion to thank everybody. But I'm going to skip that today. Sorry, guys. Today is special for more than one reason. The biggest reason, obviously, is that you're graduating, number one. Number two, we have 2 honorary degrees. Both of them are very good friends of mine. One has made it, one couldn't make it. The one who didn't make it is my classmate, and I'll talk about him later. On a personal level also, it's a special day because among you is my daughter-in-law. Congratulations, Kay. Enjoy the day. Thank you.
As Dr. Fateh mentioned, this year we are awarding 2 honorary degrees. One to an individual who has been involved with the university for as long as I can remember. Together with his son, Mr. Verma decided that he would try to increase the quality of clinical rotations for Caribbean medical students, and that he did. At this time, I would like to please have Drs. Shaukat and Samir Fateh come up for the honorary degree presentation to Mr. Avi Verma. The second honorary degree is given to Dr. Prasad Srinivasan, who so actively participates and believes in medicine and the institutions that teach medicine. He is a champion for Avalon University and what Dr. Shaukat Fateh is trying to accomplish through the university. Dr. Srinivasan could not make it here today, but Dr. Shaukat Fateh will accept on his behalf. Dr. Fateh?
Thank you. I think I deserve a right to say a few things about Dr. Srinivasan, although this is his degree. He is my classmate. We graduated together, number one, in India, long time back. I don't want to tell you that, otherwise you'll know how old I am. Number two, you could tell that he really cares about medical education. He has so many scholarships and so many things that he organizes in his state of Connecticut. But I think most of all, another reason why this day is so special is the personal reason that Kay is graduating, but also there are 2 dignitaries which we are very proud of. One is already sitting here, the Honorable Minister of Education, but Dr. Prasad, my classmate, happens to be also the state senator for Connecticut. And I think we all should be very proud of that. Thank you very much.
Now, Dr. Srinivasan believes in Avalon University so much that he has instituted, starting this year, the annual Srinivasan Award for Excellence. This award recognizes a graduate whom the faculty determines to exhibit excellence. Now, this graduate does not even know that he's getting this award. This year, the award of $1,500 goes to Daniel Kapadia. Dr. Satish Arja will be presenting this award. Daniel, can you please make your way to the stage? Next, I would like to take a moment to introduce our keynote speaker for the 2016 commencement. Avalon University School of Medicine is proud to introduce Dr. Lanny Wilson as the keynote speaker for the 2016 commencement of Avalon University. Dr. Lanny Wilson maintains a private practice in Hinsdale, Illinois, and is affiliated with Adventist Hinsdale Hospital. He is a fellow with the American College of Obstetricians and Gynecologists, and he is Avalon University's chairman of obstetrics and gynecology. Dr. Wilson is very rooted in education, serving as a clinical instructor for Hinsdale Family Medicine residents and to North Shore Medical Education Center's medical students. Dr. Lanny Wilson has proven himself a leader in the medical field, holding several appointments over the past 3 decades. I really could go on, but we only have a few hours. Here to impart his knowledge and wisdom to our graduates on this momentous occasion, I'm pleased to introduce Dr. Lanny Wilson.
Thank you, Michelle. I'm glad you didn't take 2 or 3 hours to do the presentation, because I'm going to take 2 to 3 hours to give my presentation. No, I'm joking about that. Daniel was one of my students, so Daniel, you probably heard some of the remarks I'm going to be making, so I'd like to think that maybe I had just a small role in your Excellence Award. Thank you to the administration, faculty, and graduating students for inviting me here to think that I have something special that I might be able to offer you. Congratulations to the students, to your parents, to all of those who've helped make this day special for you. You have just completed a critical step along your journey to be healers of mind and body. My hope is that each of you will be such impressive healers when you reach your destinations in your professional careers that you will have the reputation of being the doctor's doctor, the very best. Or maybe better still, you will be the kind of doctor that you will want to take care of your own family. That's pretty special. 2 weeks ago, I attended my own university's medical school gathering. After 40 years, I went back where I had graduated. After 40 years, you gather a few bits of information, maybe a little bit of wisdom, so I'd like to think that maybe I have something to share with you today about becoming the doctor's doctor or your own family's doctor. So I'm going to use a top 10 list. I hear that young folks like lists rather than just a spiel. So number 10, live fully in the now. Yesterday's history, tomorrow's a mystery. All of life's accomplishments happen in the now. Every patient encounter, every precious moment is filled with great potential. Don't waste it by being distracted. Listen well, get the patient's trust, seek to understand, and then help to make that patient's life better because of the time you've spent together with them. Make every precious moment special because you've been with them. Live fully in the now. I used to look at my patients list when I would arrive at the office and I'd see Mary Smith's coming in today. I'd think, oh my gosh, Mary Smith's coming in today. I can't wait to see Mary Smith, but I've got to endure all these other patients before Mary Smith arrives. Shame on me. Every special patient who came in and gave me her trust, I should have spent every moment enjoying every patient that came along, and today I do. Wisdom through the ages. I don't look at that list anymore. I enjoy every patient who came through. Live fully in the now. Next, number 9, choose a workplace where your health and your values can flourish. Excellence Award, John, congratulations. Daniel, sorry about that. Daniel, congratulations for getting the Excellence Award. Integrity, inclusiveness, stewardship, and compassion. These are all values that my hospital encourages throughout our medical community. These values are so important that we actually give awards to doctors who exemplify these values. Physician wellness is also part of our culture. In fact, I chair our Physician Wellbeing Committee at our hospital. We recognize that physicians who take care of themselves are better able to take care of their patients. Take care of yourselves along the way, keep balance in there. Choose a workplace where your health and your values can flourish. Number 8, develop cultures of collaboration. Well over 100 years ago, in 1910, Dr. William James Mayo, co-founder of the Mayo Clinic, delivered the commencement address at Rush Medical College in Chicago. In his remarks, he concluded with this poignant statement: "As we grow in learning, we more justly appreciate our dependence upon each other." Here we are over 100 years later, those words still ring as true as they did in 1910. Whether you call it teamwork, cooperation, union of forces, or cultures of collaboration, working in harmony with others serves the best interest of our patients. A drop of water by itself is essentially powerless, but you take a whole bunch of drops of water and put it together and make it an ocean. That's one of the most powerful forces in the world. Work together. Develop cultures of collaboration. Number 7. At least by giving this list, you can see there's going to be an end to it, right? Number 7. Be the very best at whatever you choose to do. Whenever I've finished a procedure, whether it be a simple circumcision, a complicated cesarean section, or any one of a number of procedures on my hospital privilege card, I thank the team who helped, and often will be heard to say, "That, my friends, is as good as it gets anywhere on earth." Maybe Daniel has heard me say that. There may be a doctor out there who can perform this procedure as well, but no one can perform it any better. I say that with confidence. In fact, if a procedure could be performed better elsewhere, it is my duty to my patient to either learn from that physician or refer my patient there. You understand? Be the very best at whatever you choose to do, not only for your sake, but for each of your patients' sake. You can do it. Be confident. Number 6, because you can does not mean that you should. I've got a story that goes along with that, but I think I'll run out of time if I stop and tell stories. On my blackboard in my office, it says primum non nocere. The students probably know what that means, especially my students. It means, first, do no harm. It's one of the principal precepts of bioethics. Whenever we choose to do something for patients, we always want their lives to be better because of that choice. Their lives must never be worse as a result of a procedure performed or a medicine prescribed or words that we may use with them. Share with patients the risks and benefits of every procedure and medicine we recommend. Just because we can perform a procedure and be really good at it does not mean that surgery is the best choice. One of the greatest privileges that you'll get getting your MD degree is the ability to write prescriptions. Many times a discussion, however, about non-prescription alternatives is the best medicine. Just because you can does not mean that you should. Number 5, always be kind to others. One of the things that I've noted since Avi introduced me to Avalon University, and congratulations, Avi, well-deserved, is that there's so much kindness amongst your faculty and the folks and administration and the people I work with. They exemplify kindness. When in doubt, do the nice thing, do the kind thing. Civility, courtesy, and politeness should be expressed in every interaction. Janitors and kitchen crew should not be excluded. Welcome guests and strangers. Be good stewards of your environment. Wash your hands appropriately and help prevent the spread of infection. That's a kind of kindness. Civil conversations are expected. Pleasant conversations should be cultivated. Kindness can be your superpower. Always be kind to others. Number 4, seek opportunities to teach, but always be a student. Dr. Fateh just said that so brilliantly, I'm embarrassed to repeat, but it was in my list, so here goes. Teachers touch the future by passing the baton of authentic information on to our students. What a privilege. Please seek opportunities yourselves to become teachers whenever you can. It's one of the best ways to learn something, after all. Once you think you've learned it all, though, you become irrelevant. The world is ever changing. Life and change go hand in hand. Shifting into that student role is crucial. Every teacher must be humble enough to admit his or her need to become a student regularly. Seek opportunities to teach, but always be a student. Number 3, be non-judgmental. This is one of the smallest things I have to say, but one of the most important. We cannot begin to know a person's perspective unless we are willing to walk in their shoes for 1,000 miles. Let appropriate courts and God do the judging. Physicians are servants. We're not judges. Be non-judgmental. Be your patient's servant. Number 2, never lose your idealism. Most people choose to become physicians out of a spirit of compassion and idealism, wanting to help the less fortunate. Every student I've ever taught has shared stories of their beautiful idealism. Too soon, the sheer workload allows expediency to creep into decision-making, so that what is right and ideal might take a backseat to what is easiest and least controversial. When we are overworked or fatigued, we might even begrudge our patient requests and think of them as intrusions rather than opportunities to help those in need. At a prayer breakfast that I attend regularly, one of the physicians said, "Lord, help me to always remember how good it is to be the one who is able to receive the call rather than the one who has to make the call at those inconvenient moments." Never lose your idealism. It's a beautiful thing. I see it in your faces. I see it in your eyes. Don't let expediency and the workload take it away from you. Finally, I think this has been my number 1 for several years. I changed my top 10 list occasionally, but this has always been number 1. Live by the golden rule. Whenever we care for others the same way we want ourselves or our family members cared for, we are being guided by a divine principle. Most faith traditions espouse some version of the golden rule, which essentially says, do unto others as you would have others do unto you. Whenever someone asks a patient's family member, "Doctor, what would you do if this was your family?" our answer should always confidently be exactly what I recommended for you. When we are guided by the golden rule, friends, decisions tend to be kind, compassionate, and right. Congratulations, friends, on your professional choice. With graduation from Avalon, you have become members of the world's most noble profession. Now go out there and be the doctor's doctor, the best of the best, the kind of doctor that doctors choose when they need health care. That's the doctor's doctor. Be the kind of healer you want taking care of your own family or yourself. That's the golden rule. You are made of the right stuff. If you hadn't been made of the right stuff, you wouldn't be here at this point in time graduating. You have a great education from this university. Be kind, be confident, and do it. Congratulations, and welcome to the family of medicine.
Thank you, Dr. Wilson, for addressing our 2016 graduating class. We appreciate so much your commitment to be here today in support of Avalon. Ladies and gentlemen, we're moving right along, and we have now come to the graduate address. This year, we decided to select 2 students to speak and share with you their views on their time in medical school and what the future holds for each of you. Our first graduate speaker for the class of 2016 is Mr. Farbo Bahadouri. Farbo is a student who has seen his accomplishments come full circle. Farbo has been a superior student throughout the program since he started with Avalon from pre-med. He truly is an Avalon success story, and we're proud of the accomplishments he has made and will continue making. As I said, Farbo has been a student of Avalon since the beginning of his journey to become a doctor, a young man of only 18 years old. Hence the reason I developed such a good relationship with his mom, which I'm sure he wasn't thrilled about. Farbo was very dedicated and eager to become successful when beginning his rotations in Nevada, where he became unstoppable. He pretty much achieved honors in every rotation. His hard work and determination has paid off. I'm proud to announce that beginning this July that this young man will begin a new journey in his pediatrics residency in Los Angeles. We have no doubt that he will become a phenomenal addition to their team. Farbo, you are an excellent example of how important it is to work hard so that you can achieve your goals. Ladies and gentlemen, I'm proud to introduce you to Farbo Bahadori.
Thank you, Michelle, for the embarrassing and kind words. Mom would be proud. Dear family, friends, faculty, Avalon alumni, and most importantly, my fellow graduates of 2016. It is a great honor to be able to speak at this year's graduation. I would first like to thank our family for supporting us through this journey. Medicine is a grueling profession, and there is no way anyone graduating today would have been able to accomplish this amazing milestone without your help. So thank you. I would like to thank all our teachers, attendees, and anyone who's taught us along the way. Our medical journey is a difficult one. Medicine is not something we learn from a book. These amazing people not only helped us understand medicine, but also taught us how to implement everything into real-life scenarios. Finally, I think we owe Avalon as an entity our sincerest gratitude. Without Avalon, many of us would not have been able to have the opportunity to become doctors. You truly have allowed many of our dreams become a reality. So thank you. Now, on a side note, I would like to take the time to thank the discoverer of caffeine, Mr. Friedrich Bruges. Mr. Rouge, I'm pretty sure I mispronounced your name, but I can assure you that myself and my fellow classmates would not have been able to survive early morning rounds, long lectures, followed by speeches after speeches. So thank you for your great contribution to the medical world. On a side note, I would also like to thank Dr. Conrad Fisher. For anyone who does not know who this man is, he is the 6-foot-something bald man who was yelling and screaming at the top of his lungs, chest pain, shortness of breath, hypotension, confusion, means you're not getting enough perfusion. No matter how many times your sudden outburst scared us to the point of death, you somehow managed to keep us awake and pay attention to those great important details. So thank you. Now, when deciding what I wanted to talk about today, I thought the best way was to go over and reminisce about the great memories we had on this island through the way I saw it. Trust me, it's a great idea. Picture this, an 18-year-old, fresh Canadian boy right out of high school going to a tropical island for medical school far away from home. What could possibly go wrong? Somehow, even with all the perfect beaches, clear blue ocean waters, and unlimited sun, I and my fellow classmates were able to go to class on a regular basis. At least we told our parents that. I remember walking into my first exam thinking to myself, oh God, oh God, oh God. But somehow, I was able to repeat that same phrase throughout every exam and survived. After being forced to leave paradise, we began studying for the dreaded step 1. For some of us, it was a breeze. For others, including myself, it drove us to the point of madness. We chose between social isolation, sleep deprivation, self-medication, and some of us forgot to practice simple hygiene. Then clinical years began. Internal medicine. I learned that the nurses are the angels that guided us during wards from looking completely lost. I also learned how much I truly hated paperwork. During surgery, I learned how to hold a retractor for 3 hours while getting pimped by my attending. And my friend said I couldn't multitask. I also learned how to round at 6 a.m. and ask my patients if they had any gas. My best response was, I don't know, I'm paraplegic. I'm pretty sure I smelled something, though. In psychiatry, I learned the only difference between myself and my patients were that they were medicated. In OB-GYN, I learned the need for shoe covers, and most importantly, more shoe covers. Pediatrics for some of us was a nightmare. The screaming, coughing, anxious mothers scared us to the point of never wanting to have kids of our own. But for me, I found my calling. Not only could I relate to the immaturity the children had, but the simple laughter and amusement of this rotation won me over. And to top it all off, I was taller than a majority of my patients, which was the best thing ever. Fourth year flew by, studying for Step 2 CK, Step 2 CS, the $1,500 English proficiency exam, followed by more electives, applications, interviews, and the lovely match week. And now we are here today. Near my end of my medical rotations, I've learned that I've spent well over $200,000 in tuition and fees. And since residency hasn't started, I'm only able to perform CPR and prostate exams. On a side note, if anyone needs a kidney, feel free to meet me in the back alley. Buy one, get one free. To my classmates, there are many advantages and disadvantages of being a doctor. A disadvantage is that all your family and friends are going to ask you for free diagnoses. To my family and friends, if you ask me, I'm going to tell you it's cancer. Med school wasn't cheap. Now, an advantage of being a doctor is that you can win almost any argument by simply stating that you are a doctor. No, dear, I can't mow the lawn today. The pollen will irritate my eyes, potentially make me go blind, and then I can't practice medicine. Trust me, I know. I'm a doctor. Now, I want to end my speech on a serious note. Today is a remarkable day for everyone graduating. No matter where you are in your medical career, you should be proud. We represent a small percentage of the people all over the world. We are not here by accident, and no matter how difficult the road was, you made it. The only person in control of whether you continue your dreams or quit is yourself. So don't give it up. I knew I should have made note cards. There we go. Remember to thank all the people that helped you get here. This journey is not possible for someone to do it by themselves. So if my graduating class would join me, please stand up and help me thank every single person that is here to cheer you on one last time. Thank you, Avalon graduating class of 2016, the best class to have ever left this school.
Thank you, Farbo. And congratulations again. Our second graduate address is from a student who started with us at the beginning of the MD program, Nicholas Josie. From the start, Nick excelled. As he started completing his clinical rotations, many of his attending physicians noted his strong fund of knowledge, dedication, and overall commitment to patients and to the medical profession. He too received honors in almost every rotation. I'm proud to announce that Nicholas Josie will begin his emergency medicine residency at Genesis Medical Center in Michigan. Folks, right where he completed rotations. We certainly believe that Nicholas has the passion to become an extraordinary physician due to his impeccable drive for success. Ladies and gentlemen, I'm proud to introduce to you Nicholas Josie.
Thank you very much, Michelle. A little bit taller than Farbode. Just a little bit. I'd like to start this morning by thanking the committee, the board, and my fellow graduates for allowing me to speak in front of you all. On our first morning of medical school, Dr. Patel, the anatomy professor began his lecture with a stern warning to the class. He told us to look around the room, and then, to the astonishment of most of the class, he calmly stated that 80% of everyone seated in the room would not make it as a physician. As a newly christened student doctor, who was at that time very heavily entrenched on the student side of that title, I remember feeling two emotions at the same time. First, sheer unabated terror. We had just received our white coats, and now there's a chance we may not make it? Good to know. But more importantly than the panic and the fear, I felt challenged. Now, I've never had the opportunity to ask Dr. Patel why he chose to begin our semester with that warning. Was it possible that he wanted to make sure that our class began the semester hyper-vigilant and learned the nerves, muscles, and arteries of the human body in every way imaginable? Possibly. But I'd like to think that he started our class that way not because he knew some secret stats about success rates, but rather because he was sharing with us the foresight that achieving our goals of becoming a doctor would be truly a battle. And I believe he knew that those words would challenge each and every one of his students and ultimately become the driving force to this very point in time, our graduation from medical school. Standing here today, I'm so proud to be joined by fellow students from over 13 different countries, spread all across the globe. We have 95 graduating students this semester, and they've completed over 1,112,000 man-hours during our clinical rotations, learning and assisting to treat patients from all over the country. We've studied countless more hours in preparation for national board exams and have had an excellent match this year, as you've already heard this morning, in obtaining residencies from numerous different specialties throughout the US and abroad. While it's important to note that medical school is in and of itself a daunting journey for us, the students, filled with the stresses of balancing studies, family, professional, and social lives, I would be amiss to not acknowledge that it is also one heck of an experience for our support systems, which were undoubtedly the backbones that supported each and every one of us throughout our journey to this moment today. Husbands and wives, mothers and fathers, siblings, friends, mentors, and teachers all have had a role in supporting us through the ups and downs of our journey. And for that, I would like the students to join me one more time in standing and thanking whoever and wherever your support systems may be. Plus, it's like the only time they'll all listen to me to stand up, so that's kind of cool. Now, graduation from medical school is an amazing achievement, but to risk being the bearer of bad news, our real journeys have just begun. The hard work truly starts now. See, for some of us, that means in a few short weeks, patients, nurses, fellow doctors, and yes, even medical students will be looking to you to make decisions, all on your own, no safety nets anymore. For others, your goals have taken you on a path to pursue a career in research or medical education, and for others yet, the next step may be returning home and caring for your local population of the sick and injured. Regardless of what your next step is, we all need to prepare ourselves for the real-world aspects of medicine now. We need to prepare to have our hearts broken, as people will pass away despite our best efforts. Complications will occur, even to the most skilled and cautious among us. Administrators and red tape will sometimes stand in the way of taking care of our patients. Yet despite all these truths, there remains wonderful aspects of medicine. People will look up to you and respect what you do and say. People will trust you, confide in you, and allow you the privileged opportunity to care for their children, parents, and loved ones. To each and every classmate graduating today, you can do amazing things for people if you get involved with the process of setting the needs of your patients before everything else. Because at the end of the day, as a doctor, that's all that really matters. Let us go forward now, armed with all that we have achieved, as we tackle the stark reality of the times that lie in front of us. Stay motivated, believe in yourselves, work to do good by your patients, and appreciate all the opportunities that our collective futures hold. After all, as Dr. Patel would say, we are the lucky 20% who have made it here today, and there are plenty of others who would give anything to be in our shoes. Congratulations to the class of 2016.
Thank you, Nick, and congratulations on a job well done. Well, we have come to the highlight of this morning. At this time, we will now begin with the hooding of the graduates and the presentation of Doctor of Medicine degrees. The hooding of the graduates will be completed by Dr. Satish Arja, Executive Dean, and conferring of the degrees will be done by Dr. Samir Fateh, President of Avalon University, and a special guest, the Minister of Health, Curacao, the Honorable Irene Dick. Abu Bakr Al-Fauri. Chioma Azod. Farbo Bahadori Asfahani. Meta Chen. Alejandro D. Orduna. Robert Diebick. Jatin Desai. Izu Ifobi. Come up here. Vern Erickson. Gwendolyn Fassion. Christopher Goodman. Magna cum laude and Dean's List. Jawad Hassan, cum laude and Dean's List. Dara Isang, magna cum laude and Dean's List. Richard Jones, cum laude and Dean's List. Chantal Johnson. Nicholas Josie, magna cum laude and President's List. Danielle Capadia, summa cum laude and President's List. Moby Cosme. Zishan Khan. Kunzul Khan Fateh. Lynn Kine, cum laude. Rajiv Malapudi, summa cum laude and President's List. Marcia Mather, magna cum laude and Dean's List. Amara Minhas. Yusra Morsi, summa cum laude and President's List. Geeti Musavi, magna cum laude and Dean's List. Ata Nasir. Karen Nichols. Mecca Obikwe. Kayode Oladumi. Grace Otua. Faisal Patel. Hema Patel, cum laude and Dean's List. Tokir Kazi, magna cum laude and Dean's List. Nora Radwan, magna cum laude and Dean's List. Jason Salmons, summa cum laude and President's List. Herlene Sandu, summa cum laude and President's List. Hooding will be done by Dr. Kiami. Wilson Varghese. Nina Vakima, summa cum laude and President's List. Lily Yusufi. Thank you, Dr. Arja. At this time, I would like to ask our Avalon alumni, Dr. Anthony Russo, to lead our graduates in reciting of the Hippocratic Oath. Graduates remain standing.
Repeat after me. I do solemnly affirm, as did the ancient Greeks, by all that I hold most sacred, that, according to my ability and judgment, I will keep this oath in its stipulations. I hold my teachers in this art are equal to my own parents, and extend to them the respect and gratitude which they're due. I will by precept, lecture, and every other mode of instruction impart a knowledge of the art to my progeny and those of my teachers, and to the disciples bound by covenant and the oath according to the law of medicine. I will follow that system of treatment according to my ability and judgment. I consider for the benefit of my patients and abstain from whatever is deleterious and mischievous. I will exercise my art solely for cure of my patients and the prevention of disease, and will give no drugs and perform no operations for a criminal purpose, nor far less suggest such a thing. With honor and dignity, I will practice my profession, not permitting consideration of religion, nationality, race, or social standing, to intervene between duty and my patient. Into whatsoever houses I enter, I will go for the benefit of the sick, and will hold myself aloof from every voluntary act of wrongdoing or corruption. Whatever I may see or hear in the lives of others, which ought not be spoken abroad, I will not divulge, reckoning that such should be kept secret. while I continue to keep this oath unviolated, may it be granted to me to enjoy life in the practice of the art respected by all people in all times. But should I trespass and violate this oath, may the reverse be my lot. On behalf of the Chancellor, Council, and faculty of Avalon University School of Medicine, I now confer upon you the degree of Doctor of Medicine with all the rights and privileges thereto pertaining. At this time, graduates, can you please move your tassel to the left, signaling your official translation to Doctor of Medicine. Congratulations, 2016.
It's an amazing experience. The whole road of medical school has been, it's been a daunting task, but it's been a lot of fun. And it's been a dream from the beginning, and stepping into it, it kind of jumped in head first. And it's been an amazing experience, and it's a very momentous day to be graduating today. Very excited.
I just really enjoyed working with Dr. Upatori as the OB for a while. And, we'd run to the hospital, deliver somebody, and then go in and do C-sections and do all that. It was very exciting. I enjoyed him. He was always upbeat, positive about the profession. Despite the changes that were occurring, he'd always stay positive and enjoy taking care of the patients. So I learned a lot from him.
I'm excited for everybody who is here because we really work hard. It was not an easy journey, but we made it.
My preceptor was Dr. Sangade in West Virginia, and I learned a lot from him, and all my rotations were a life-changing experience because I met all these amazing doctors, I met all these amazing patients, and you know, it just makes you feel accomplished at the end of the day because you make somebody smile. You just get to help somebody.
You know, it's been a long road, and I know for some of the other graduates, you know, for some people it's been longer than others. For me, it took forever. But you know, I'm finally here, and it was worth every minute of it.
My experience has been tremendous. It's been an awesome experience. I've met a lot of people. I've been in a lot of places. I've done a lot of things prior to getting here, and this kind of like put the icing on the cake, because what it did, it just let me know that everything that I've done in the past had a purpose.
Everything was wonderful. The staff's been amazing. The island was a blast. Really learned a lot and grew a lot from it. Avalon's a great school.